Thank you all for coming tonight, and I want to thank Dr. Siebert for asking me to be here this evening. I am the director of the Bradley Free Clinic and a volunteer with the Hope Initiative, but more importantly, I'm the mother of 3 wonderful children. My children's names are Bobby, Ricky, and Hannah. My oldest son, Bobby, went to Hidden Valley High School and graduated in 2005. In high school, he played football, was a talented writer, loved cooking, was funny, kind-hearted, caring, and giving. He also loved to be active. He loved hiking, snowboarding, and kayaking, all of which he enjoyed doing with his family and friends. He probably sounds like any other kid, maybe your neighbor's child, a grandchild, a nephew or niece, or a friend. He went off to college in the fall of 2005. Towards the end of his freshman year, he had ACL surgery and was prescribed a 90-day supply of pain meds, OxyContin. It was that summer that changed the course of his life forever. He became addicted to pain medication, and by the spring of his sophomore year, he dropped out of school, suffering from anxiety and depression, and failing his classes. Within 6 months after being home, he was involved with the police. I will never forget when I first realized my son was an addict. I vividly remember going through the things in his room and finding a box in the back of his closet full of childhood memorabilia and discovering a smaller box, a box of hypodermic needles wrapped in his baby blanket. At that time, I thought that was the most devastating moment of my life. Having a son that was a drug addict and repeatedly in trouble with the law was something I never expected would happen to my family. From then on, he was in and out of jail and rehab. It was a never-ending cycle: jail, rehab, relapse, and then back through the vicious cycle again. His addiction was not only destroying his life, but the lives of our entire family. He had stolen my credit cards, pawned items in our home, and I was constantly in fear for my son and my family, and would spend many sleepless nights waiting for the phone call from the police that he had overdosed. I felt so helpless and tried time after time to figure out how to get my son the help he so desperately needed. But because he was over 18, I couldn't make that decision. Several times I ran into problems with insurance companies, doctors' offices, the court system, and rehab centers because he was over 18 and they wouldn't talk to me. Then there was a problem that there were no beds available at any of the treatment centers. The system is extremely difficult to navigate and completely ties our hands as parents, especially when our children turn 18. Eventually, he spent 3 years in jail. And you know, I was very grateful for that, because he was at least safe and he was drug-free for those 3 years. There he learned a trade. He got his journeyman's license as an electrician, and then certification in heating and air conditioning. And it was there that he found his higher power to help him in recovery. I was so proud of him. When I went to visit him, I saw the light in his eyes and the smile on his face return for the first time in a long time, and did not see him anymore as a drug addict. When he got home, I was so proud that he had turned his life around, and for the first time in many years, I felt I truly had my son back. He told me, "Mom, I know I've been given a second chance, and I'm not going to ruin it." Then he got a job here in Roanoke, and I was so grateful his employer gave him a chance, because as you know, it's extremely difficult to be hired with a felony record. He worked hard every day. He was working 5 days a week. He would get up at 6 a.m., pack his lunch, work long and hard days, and come home at 7 p.m. He was proud of all that he had accomplished and was given a promotion with more responsibilities. But then he let the people from his past back into his life, and it triggered his addiction. It all seemed to happen so fast. It was a warm, sunny Saturday in June, and my daughter and I were at the softball field all day. And when we returned home, I found him lying on the floor of his bedroom, his body cold and blue, and the EMS couldn't revive him. My son, Bobby, died on June 6th at the age of 28 from an overdose of heroin laced with fentanyl. Sorry. After his death, I felt alone in my grief, wondering what people would think. It was months after my son's death that I discovered this was a national epidemic happening all over the country, and I was not alone. I went to an event in Washington, D.C. last fall, not knowing what to expect, and found myself among 5,000 families that had lost a child, a parent, or a relative to opioid and heroin overdoses. Since then, I've been determined to find out what is happening here in Roanoke and raise awareness about this horrible epidemic. But I keep asking myself, why didn't I know about this before now? I've met many young adults in our community this past year that have seen so many of their friends suffering and dying from this disease. Recently, Ashley spoke with me at a community forum in July. She's 29 years old, and she told us how her brother struggles with addiction. She spoke of a picture her brother has of his friends from high school, and of the 5 kids in the picture, he is the only one that is still alive. She looked through her high school yearbook and was able to identify 54 kids within those 4 classes that are currently struggling with addiction, and many of them have died. We have been and are continuing to lose an entire generation of young adults to overdoses. For me, I didn't know what I didn't know. I didn't know how dangerous and addictive pain meds are, and that they're directly linked to heroin. The medical community is starting to make changes, but as Dr. Burton will tell you, this will take time. Ironically, 4 weeks ago, I took my 15-year-old daughter to an urgent care facility because she sprained her thumb. Nothing was broken, just a sprain. The doctor said, take ibuprofen and ice, and then they put a brace on her hand. Then he said, let me give you something to help you sleep tonight. I didn't say a word. I wanted to see what he was going to prescribe. And to my utter shock, he prescribed oxycodone. I told the nurse we didn't want this and said, well, you don't have to fill it. We, of course, did not fill it. I was not only shocked it was prescribed, but we were never informed by the doctor or the nurse the dangers of oxycodone, and that the parents should dispense it because of its dangerous nature. I can only hope that by all of you being here today that you will be aware of this. So I didn't know what I didn't know. I didn't know that addiction is a disease and needs to be treated like a disease, not a moral failing. We need to shed the stigma of addiction, to show kindness, compassion, and support to those who are struggling with a family member or a friend who is addicted or has died, not to judge them, because no family is immune to this. Parents have come into the Hope Initiative and said, thank you for understanding. For years, I've kept this a secret and felt I had nowhere to turn for guidance or help for my child. Our family is worn out, and I just want to thank you for giving us hope. Excuse me. The Hope Initiative is a new collaborative effort that's entirely volunteer-driven. Its initial start came from Lieutenant Bill Breedlove with the Roanoke Police Department to establish a volunteer network of angels that assist those who are suffering from substance use disorders in any form, opiates, marijuana, alcohol, to find resources and access services available for treatment and recovery, hopefully before an overdose or a fatality occurs. This program is also designed to inform the community at large as to the severity of the opioid epidemic facing our community. The Bradley Free Clinic, Carilion Clinic, and other local agencies, along with a network of 32 volunteer angels, have partnered with the police department, creating a community-based drop-in session once a month at the Bradley Free Clinic. So far, we've helped 42 participants find treatment. Prevention and awareness is so critical. We need to educate not only our youth, but our parents too, before it's too late. In March, I was asked to speak at a play at the Children's Theater. It was called The Ice Cream Man. And Nancy Hands from the Prevention Council, she asked me to speak for the first time, and I am very grateful for that. My 15-year-old daughter's freshman class from Cave Spring High School was scheduled to see the play. I warned her that it was very realistic. It might be difficult for her to see, and I don't have to speak after the play. Her response to me was, "No, Mom, you have to tell them Bobby's story. Kids at school think it's no big deal." My daughter sat in that audience with tears rolling down her face as I talked to the kids in her class. She gets it. She knows we have to talk about this. What a brave thing for a 15-year-old to do. Can you imagine? I've been speaking out for several months now. I've spoken in front of Congress, and I realize that it's not just about speaking out. It needs to be a call to action. This is a public health crisis, not just a law enforcement issue, and it's in every community across the country and here in Roanoke. It doesn't discriminate. It crosses over into all of our cities and counties and every socioeconomic background. We are in need of better awareness and prevention in our community, and we need to increase and strengthen the availability of treatment and recovery services. We are so underserved with treatment and recovery services here in the Roanoke Valley. The power of these community forums is in the action that results from them. Please take this message and tell everyone that you can what is happening here, and let's try to make a call to action. Thank you so much.